Hi everyone, I'm Catherine Menord, and today I'm going to be talking to you about hepatitis B. We're going to be going over some of the causes, the symptoms, the treatments, and prevention, and just kind of get you familiar with what it is and how it can be prevented. Hepatitis B is a serious liver infection caused by the hepatitis B virus, HBV. First, we'll go over the causes and how hepatitis B is transmitted. So, hepatitis B virus is passed from person to person through blood, semen, or other body fluids. Common ways HBV is transmitted is through sexual contact, sharing of needles, accidental needle sticks. So, anyone that works in a hospital is at higher risk for coming into contact with hepatitis B, and also mother to child. So, the mother that's pregnant and infected with HBV can pass the virus to their baby during childbirth. There are two types of hepatitis B: short-term acute hepatitis B or persistent chronic hepatitis B. The acute hepatitis B infection lasts less than 6 months. The chronic hepatitis B infection lasts 6 months or longer. Now we'll talk about how to prevent becoming infected with hepatitis B. You can protect yourself against the infection by avoiding contact with the body fluids of someone else whose health and sexual history aren't known to you. To prevent infection, use a condom when you have sex, do not share needles, do not share toothbrushes or razors, wear latex or plastic gloves if you have to touch blood, don't get a tattoo unless you are sure the needles have been cleaned properly and are sterile. If you already have hepatitis B, you should take steps to prevent it from spreading to other people, such as not donating blood, not sharing razors, or other toiletries. So what are the symptoms of hepatitis B? Most people who have an acute hepatitis B infection don't have symptoms. However, if you do have symptoms, they may include extreme tiredness, mild fever, headache, loss of appetite, nausea and vomiting, constant discomfort on the right side of the belly under the rib cage where your liver is located, tan-colored bowel movements, dark urine, or jaundice, which is the skin and whites of the eyes look yellow. Jaundice is a major sign of liver damage. Treatment for the hepatitis B infection depends on whether you have been recently infected with the virus, have the symptoms of an acute infection, or have a chronic infection. If you have not gotten a hepatitis B vaccine and think you may have been exposed to the virus, you should get a shot of the hepatitis B immunoglobulin HBIG in the first of 3 shots of the hepatitis B vaccine. It is important to receive this treatment within 7 days after a needle stick and within 2 weeks after sexual contact that may have exposed you to the virus. The sooner you receive the treatment after exposure, the better the treatment works. If you have symptoms of an acute infection, treatment with antiviral medicine usually isn't needed. Home treatments such as eating well, drinking plenty of fluids, and avoiding alcohol and drugs usually will relieve your symptoms. Treatment for a long-term chronic hepatitis B infections depends on how active the virus is in your body and your chance of liver damage. The goal of treatment is to stop liver damage by keeping the virus from multiplying. Antiviral medicine is used if the virus is active and you are at risk for liver damage. Medicine slows the ability of the virus to multiply. Antiviral treatment isn't given to everyone who has chronic hepatitis B.